we did a presentation at the Nursing Association symposium, and I remember doing the presentation, and I just didn't get the feedback that I thought I was going to get. And one of the moderators was like, and he can tell you where you fit based on your personality. And like the crowd went crazy, the room went crazy, and I realized, oh, this is kind of where I need to be. So my gut has been telling me that there was something missing, and so we kind of roll with it, and it's changed our company since then.
Matt Phillips here, co-founder of Sbur Decision Lab. We feature entrepreneurs sharing their stories and decision-making so you and other entrepreneurs can make smarter decisions and achieve success. Please enjoy this next episode.
We'll start with, what's your name?
Yeah, Joel Francois.
So, Joel Francois.
Yeah.
It's a cool name. What's your company's name?
Our company name is Helios Health.
And how do you describe your venture in one sentence?
One sentence: we're enabling personality-based clinical alignment in healthcare.
And what's the problem, and why did you decide to solve this problem?
The problem is really high turnover and really a lot of challenges in healthcare for retaining clinical staff. And I decided to tackle the problem because I have a lot of physicians and clinicians in my family, and we had a lot of conversations around some of the challenges around why a lot of them are leaving healthcare. And I felt that they're frontline workers. We saw what happened with COVID. I just felt like they really need more in terms of support, in terms of guidance and direction and help. And with what we were already building, it felt like the right fit.
All right, it does. Yeah. And Joel, what would you say is the hardest decision you've made on your journey so far?
From a entrepreneurship standpoint, I think especially in tech, it's very difficult not to get caught up in the noise and the romance of tech. And so I also advise founders too. That's one conversation that we have a lot. There's so much going on in social media, blogs, and podcasts around what the journey should be. But I think that the biggest thing that we've done, that I've tried to do personally, is just stay the course. Understand that the story that I'm hearing about this journey is not really my journey, and it's also a lot of times it's not as accurate as you think.
Yeah. What would you say is a decision you've made with incomplete information that ended up being a pivotal decision?
I think even the pivot that we did, to be quite honest, initially we were building a recruiting platform for clinicians, but relying on my gut and kind of get a sense of like how were we perceived, how were we positioned. And we did a presentation at the Nursing Association symposium, and I remember doing the presentation, and I just didn't get the feedback that I thought I was going to get. And one of the moderators was like, and he can tell you where you fit based on your personality. And like the crowd went crazy, the room went crazy, and I realized, oh, this is kind of where I need to be. So my gut has been telling me that there was something missing, and so we kind of roll with it, and it's changed our company since then.
What's something that didn't work out? That worked out great. What about something that didn't work out that if you could do it over, you'd do it differently?
I think in general, as founders, we spend too much time building too much too soon. So initially, I think what didn't work out was we focused a lot on building products and building features because of a lot of the noise and the romance too. But really realizing that it ultimately starts with really the relationships that you have, and also like being able to leverage that and being able to really be okay with climbing one mountain to climb the next. So I think that was the big part.
It's a good lesson in that.
Yeah.
Okay, now we're getting to the hard ones.
All right.
What are the key decision-making elements and process that you use, and why?
I'm always asking where I'm not doing well, or what's missing, I guess is my point. I'm not a negative person. I'm really positive and confident in what I'm doing, but this is kind of like a family trait. I give my dad the credit. I'm always like really kind of looking at what mistake that I think that I made, what is missing. I'm always asking what's missing. And I think as entrepreneurs and founders, like we can fall in love with like what we're doing and us and our decision-making process, and not really be objective around like where you can be better. So that's been really important.
If you could go back and redo a decision, what would it be?
Number one is what I call tribe building. And I tell all founders this as well. There was a friend of mine that she was helping me with my company early. And I remember she asked me some questions, and she was like, Joel, you don't have any industry friends. Her name is Pardis. She's a big star in the Boston tech scene. So if Pardis sees it, she'll know.
Yeah.
And she was like, Joel, you don't have any industry friends. And I never really thought about that, because I was a disruptor. I just go in, like, they have an idea. I'm gonna change the world. I'm gonna change this industry. And I think that was an eye opener. And it took a long time to understand that you have to leverage relationships. You have to nurture and cultivate relationships. Because even from a tech standpoint, that's going to be your first customer. That's going to be where you get introduction to maybe an investor, to maybe a co-founder. It's not just about just go build and like I have this really smart idea. So from that point on and from now on, that's always my first thing is like nurturing my relationships better.
What's something you are wrestling with right now?
Fundraising, I understand that in order to scale, the need to raise capital is super important. I'm a control freak, to be quite honest too. And I advise other founders. So like, and I have mentors. So like a lot of times when you talk to founders that raise money, they all say the same thing. Oh, I should have raised later. I should never raise. So they don't really help in a lot of ways. But I think where we are right now, we have a lot of momentum and we have a lot of validation that is happening right now. And we're looking to really take advantage of a big opportunity. But I have to get out of my own way, I guess. And so that's what I'm kind of struggling with. And I'll get over it. But right now, at this moment, that's what I'm thinking about.
Great. What is the most uncomfortable decision you've made as a founder?
I think knowing when to let go, like even pivot a company too. Like I remember I had a prior company and it was hardware and software. And like I remember talking to investors and I had an investor, like, I forgot his name. And he was like, there's easier ways to make money, right? And I took it as an insult back then, right? But investors hate hardware. They hate everything that's about it. And me, I had this solution that I felt that was going to change the world, but it was hardware and software combination. And I held on. And then COVID came and nobody was touching physical things. And COVID kind of helped me make that decision. But I think that was a big lesson.
What decision frameworks do you use most often when you're faced with a tough challenge?
I built my own. I'm also co-founder of a venture studio called Co-Found. And as a founder of color, you have different challenges in terms of navigating the tech landscape. And because of that, me and a number of founders got together and really started really thinking about like, what kind of framework can we use and how is our journey different and how we can leverage that. So we built my own plug. And it's really based around, again, get rid of the noise, get rid of the romance, validation, like execution, and still being able to deliver what investors need and what the community needs, but to really understand like where your value is and where it's not. So I follow, like I drink my own Kool-Aid, and it took us 2 years to build a framework. So it's really effective. I'm gonna stick to it until it shows that it's not.
Super. Great interview.
Appreciate it. Thank you. Hi, everybody. I'm Joel Francois. I'm CEO and founder of Helios. And Helios is building the workforce intelligence layer for the healthcare workforce. A little background. Helios started off as a recruiting platform for clinicians. We started getting feedback from users and we kept on hearing, I got to get away from bedside. I got to get away from bedside. But no one seemed to really have an idea of where they wanted to go. What we quickly realized was that the conversation was not really about rejecting the field. It was really a conversation around misalignment with specialty. And that's where we saw that there was this fresh $80 billion opportunity. So the other thing that's happening is that healthcare is in the middle of this pending storm. Next couple of years, we're going to be looking at a 1.8 million nurse shortage. The nurses that we do have, we're losing roughly 22% of them annually. And it's costing health systems over $61,000 to replace an RN currently. So by 2030, all 73 million baby boomers are going to be over the age of 65, and they're going to be putting way more pressure on clinical demand as well. What we've discovered is that there is this overlooked relationship between personality and specialty. Matter of fact, 4 of the top 11 reasons for turnover are directly tied into specialty selection in healthcare. So this often leads to this misalignment in field of practice. It leads to this low user engagement or employee engagement. It leads to poor burnout management. And when you add in this lack of real-time workforce insights, we get these delayed and ineffective organizational interventions. So essentially, healthcare is training nurses, healthcare is developing nurses, but they're misplacing them and they're burning them out. So it's not just a shortage problem, it's a misallocation, it's an attrition problem as well. So this is where Helios comes in. So what we're using psychometrics and AI to align clinicians with specialties based on their unique personalities. What we're doing is that we want to preemptively able to align them. We want to preemptively able to address clinician retention issues and also predict turnover as well. So we're using our own proprietary psychometric model, and we use that to address the misalignment. We're using conversational AI to collect real-time workforce data at scale. We're using live sentiment analysis to be able to predict and also identify burnout and dissatisfaction early. And then we're using our exit risk index to be able to predict which employees are going to resign within the next 90 days. So the way it works is that Users and nurses and clinicians, they engage our chatbot. They complete a personality assessment to receive our specialty recommendations. And then we have an AI agent that checks in periodically. And we're collecting real-time data, and we're converting that user insight into predictive intelligence to empower organizations as well. So we've already have over 300 users. We've already generated $60,000 in revenue. We just launched a 3-year project with the state of Oklahoma's Nursing Workforce Council. And that also means that within that project, we have a partnership with 5 nursing programs in Oklahoma and also 3 health systems as well. We are also in vendor diligence already with HCA Healthcare, which is the largest healthcare system in the country. HCA represents 190 hospitals and 300,000 nurses. So we also been approached by the largest clinical training platform in the US, which is HealthStream. HealthStream represents 5 million healthcare workers as well. And what they're looking to do is they're looking to have a partnership for distribution. So what that does for us is that it puts us in a position where we're going to be able to scale our distribution and also puts us in a position for a strategic exit as well. And while all this is happening, we already have been highlighted. Our work has been highlighted by the National Forum of Nursing Councils. Our work was highlighted by ACTE, Association of Career Technical Education. And that's it? Okay. That's all I got.
Now that you've heard the story and the investor pitch, where are you in your startup journey? What decisions are you wrestling with? Comment below or take a quick survey, and we'll let you know just how investor ready you are.